some of you in the room know I'm significantly deaf. And there's certain levels of voices I can't hear. Unfortunately, my wife is not one of them, but Linda is. So I have no idea what kind of nasty things she has said. So if you guys will pass me notes during the afternoon, I would appreciate it. She's been inviting me to speak before this group for many years. And I've always had to say no because I feared a conflict of interest. I might find myself someday forced to write about the interesting things you do, this feisty organization and the gutsy approaches you take to areas that others ignore or choose to bypass. However, in January, just 6 hours after the corporate Simon Legrees from Hearst newspapers told us that we were closing, Linda called to share her condolences and to promptly tell me there was no longer a conflict of interest. So I'm here. And I need to tell you that I speak a lot around the country, but I am really proud to be here. This is a group and this is a room filled with many people that I truly admire, with people that I consider to be heroes, people without whom I could not do my job. I'm going to come back to that, all right? I was asked by some of you to speak about what I do, how I started, and what's it like to be one of the few investigative reporters in the country that specialize in public health issues. Well, the simple answer of why I do it is that I love it. I can't think of a better way of spending my life. But getting back to your questions, I'll start with a story. And most good stories start on a dark and stormy night. My entry into the world of public health was in a blizzard in a small coastal New Hampshire town in the late 1970s. I was working for the Associated Press then, trying to go somewhere that I can't recall, but it was late and I needed either coffee or a drink. And the only place in this town with the lights on was an Elks Club or a Moose Club or a VFW, I can't remember which. I went in, the bar was empty, but in a nearby room I could hear voices. Inside was a very young man talking very loudly to a group of well-worn old-timers. And he kept telling them, remember the names of those you worked with. It's important. And every couple of minutes, one of the old-timers would lean on his cane and get up and say, I worked with Charlie, and he's dead. And somebody else would say, Ernie died too, and he worked right next to me on the Nautilus. I spent a lot of time with that young doctor the next few days. And a week later, on the front page of the Boston Globe, and inside 100 other papers, was a story on a Boston VA hospital hematologist named Thomas Najarian. And Dr. Najarian had discovered that a group of his patients, kind of a motley crew of leukemia victims, had all worked on the Navy's first nuke submarine, the Nautilus. He was very concerned about this cluster of disease. He was frustrated. The Navy wanted him to go away. His bosses at the VA threatened to fire him because Najarian wanted to know how it happened and how widespread the problem was. The Associated Press let me chase the story for a while. I went to shipyards all over the place, and I found lots of other workers that had worked on the earlier nukes were also sick. and I found physicians and public health specialists who knew of this connection between their disease and the fact they'd worked on subs. Nigerian was correct, the problem was widespread. On a very cold morning in January 1979, it was a long time ago, probably the last day of the month, I stood with a group of public health workers and union officials at the shipyard gate at the Portsmouth Naval Shipyard. They were going to go in. The military police stopped us. I may be wrong, but I believe that was the first time I met a young union public health worker named Peg Seminary, who was in the crowd, being threatened by the police. Admiral Rickover asked the head of the AP to make me stop, said I was on a search and destroy mission. He didn't much like Peg either, but she didn't back off. That young physician and the union health specialists were the first in a really long list of occupational medicine and public health heroes that have made my professional life so full. As a reporter covering public health, I get to write about these heroes. And I call them heroes rightly, knowing the impact and the meaning of the word. In my mind, these people protect the lives of others, improve the lives of still more. I write about them and the battles they fight. The battles are often against uncaring corporations and disinterested government. Some of them somehow find the time to make me a better reporter. Some of them are in the room. Mike Harbuck, Dick Lennon, Barry Castleman, Steve Levin. Some of them aren't, like Celeste Monfortin, Alan Whitehouse, Brad Black, Dr. Aubrey Miller, Dr. David Eagleman, Jennifer Sass, Laurie Kazan Allen. These people are just some of a very long list of health professionals, of people who care, who've helped me understand what was happening to the Les Gramsteds and Gala Benefields of the world. There are dedicated heroes in my world that work for NIOSH, EPA, CDC, even the FDA. They're quiet, they're rarely quoted, but they help me. Just as many of you did. They help me report on the real victims as well as the health and policy implications. Not only on asbestos in Libby, Montana, but also on pesticides and butter flavoring called diacetyl, human testing on children, the hazards of nanotech, and the other rapidly emerging dangers that are just out there on the horizon. These people graciously answered my questions. They teach me using the simple words that I need so I can help my readers understand. They keep me accurate, and should I stray, they do let me know. For a moment, let's talk about the group that brought us here this weekend. Linda gets her hero wings from me. So do the people that work with her. ADAO is filled with heroes for telling the world what it needs to know about asbestos. and for your efforts to step forward, ignoring the political dangers which are very real, and push for a meaningful ban on this deadly fiber that we all know too well. To Linda and her colleagues who work tirelessly, they and everyone else in this organization deserve credit and praise. From those who fight like Doug to get the word out, to those peering through a microscope, counting the fibers of asbestos. You had the courage to stand up to powerful makers of asbestos-containing consumer products and toys that fill the toy store shelves at Christmas. Your actions will save lives. I want to close with a brief tale showing why reporters cannot do it alone. We only inform the public. If anything happens, it's because the public demands their lawmakers, their regulators do something. Soon after we found out what was going on in Libby, I learned of another vermiculite mine in the country, in a place called Louisa, Virginia. The mine had been around for years. It was so contaminated that W.R. Grace sold it for $1. Never mind it. The new owner, Robert Sampson, was a former White House fellow and an assistant administrator of the Environmental Protection Agency. So it really didn't matter that the vermiculite samples we pulled off the back of a slow-moving truck were loaded with 7 to 15% asbestos. The EPA, Region 3, didn't care at all, but the workers were frightened. It didn't matter to EPA. EPA may not have cared, but Celeste Monforton did. She was the heart and soul of the often uncaring Mine Safety and Health Administration. I'm not sure what her real title was, but whatever Davitt McAtee, who was then the head of it, needed done and it involved people, Celeste made sure it happened. They looked closely and they knew that their inspectors who were coming back from Louisa were taking samples that said non-detect, there's nothing there. What are you talking about, Schneider? This is safe, this is good. Helps the economy. Celeste met late at night in diners and bars between DC line and the Virginia site of this mine. She met with workers who were there. She met repeatedly. They would bring her samples and she would say, I can't use these. I'm sure they came from where you told me they came from, but I can't use it. There's no chain of evidence. So they drew maps for her. They showed her where the asbestos was and where they were mining. And they told her that every time the government inspectors came in, the managers of the mine knew about it ahead of time and they quickly fenced off the bad areas and went to the few clean areas they knew about and mined that until the inspectors had left. Celeste brought in inspectors from around the country that she knew were ethical, that she knew cared about the worker safety. And she went with them, with the maps from the workers, and took samples. She went unannounced. Robert Sampson was not happy. The samples were hot as hell. They were loaded with asbestos. Something had to be done. But before any real action could be taken against the very politically savvy owner, another administration claimed the White House, and there was new management in Emshaw. The company is still selling vermiculite. You guys can figure out whether it's clean or not, because no one in the government's looking at it right now. What the world needs is another Celeste in Emshaw. and more heroes in the world of public health on every aspect, from families of patients to the public health nurses, to the industrial hygienists, to the physicians, everyone, all of you. They need more of you doing what you've done so long and must continue to do to make everybody safer. And I'm pleased to be part of you at times. Thank you very much.